Did you know that the health of your thyroid could be the key factor in realizing your dream of having a baby? Often overlooked, the thyroid is fundamental to the body's hormonal balance and can be directly linked to your ability to conceive. Do you feel like you've tried everything, but pregnancy still hasn't happened? Perhaps the answer lies in your thyroid. In this video, we'll explore the profound relationship between infertility and the thyroid and uncover how small hormonal imbalances can drastically affect your chances of getting pregnant. Could your thyroid be sabotaging your chances of becoming a mother without you even knowing it? Let's find out. The thyroid, a small gland located at the base of the neck, produces essential hormones that regulate metabolism, but its impact goes far beyond that. It plays a crucial role in the reproductive system, controlling hormones such as estrogen and progesterone, which are essential for the menstrual cycle and fertility. These thyroid hormones, T3 and T4, act directly on the ovaries, influencing the development and release of eggs. When there is thyroid dysfunction, such as hypothyroidism or hyperthyroidism, this communication between the thyroid and the reproductive system becomes dysregulated. This imbalance can lead to irregular menstrual cycles, poor egg quality, and even interfere with preparing the uterus for embryo implantation. In addition, the thyroid interacts with the hypothalamic-pituitary axis, which regulates many of the sex hormones. When T3 and T4 levels are altered, the brain can receive confusing signals, adjusting hormone production inappropriately and impairing reproductive function. Both hypothyroidism and hyperthyroidism can significantly affect fertility, although in different ways. In hypothyroidism, the thyroid gland produces fewer hormones than necessary, which results in a slowdown in metabolism and can cause irregular menstrual cycles or even a lack of ovulation. Without regular ovulation, conception becomes much more difficult, and there is also an increased risk of miscarriage, even if fertilization does occur. Hypothyroidism is also associated with high levels of prolactin, a hormone that, in excess, can inhibit ovulation. In addition, low levels of T3 and T4 can affect the quality of the eggs, hindering the fertilization process and the healthy development of the embryo. Hyperthyroidism, characterized by excessive production of thyroid hormones, speeds up the metabolism and can lead to unregulated hormone release, causing irregularities in the menstrual cycle. In cases of hyperthyroidism, egg quality can also be impaired, affecting the ability to conceive and increasing the risk of pregnancy complications. Women with hyperthyroidism may experience an anovulatory cycle, where there is a menstrual cycle without the release of an egg, making conception difficult. In relation to menstruation, in hypothyroidism, where the thyroid is functioning slowly, low hormone levels can lead to longer cycles and heavier menstrual periods, causing, in some cases, an increase in prolactin levels. This hormone, when in excess, can inhibit ovulation, making conception even more difficult. On the other hand, in hyperthyroidism, high levels of thyroid hormones speed up the metabolism, leading to shorter menstrual cycles and often lighter or even absent periods. This imbalance can create an unfavorable hormonal environment for the development of healthy eggs and the preparation of the uterus for a possible pregnancy. Thyroid problems not only affect the ability to conceive, but can also pose risks during pregnancy. Both hypothyroidism and hyperthyroidism increase the chances of complications that can impact both mother and baby. In the case of untreated hypothyroidism, there is an increased risk of miscarriage, premature birth, and even placental abruption, which can compromise the baby's health. In addition, an underactive thyroid can influence the neurological development of the fetus, since thyroid hormones are fundamental for the growth of the baby's brain and nervous system, especially in the first months of pregnancy, when it depends on the mother's hormones. Before continuing, if you're learning about the thyroid and want to delve even deeper into your health, check out the video description for my exclusive ebook with valuable information and practical tips to better understand your thyroid health. Also, subscribe to the channel, turn on notifications, and join our community to find out more. Hyperthyroidism in pregnancy can also cause serious problems, such as gestational hypertension and preeclampsia, which is a dangerous condition characterized by increased blood pressure and can lead to serious complications for mother and baby. It also increases the risk of heart failure for the mother and growth restrictions for the baby, since the excessive production of hormones affects fetal development. For these reasons, it is essential that women with thyroid problems receive proper medical care before and during pregnancy, adjusting hormone levels to avoid these risks and promote a safer and healthier pregnancy. Assessing thyroid function is a crucial step for women facing difficulties in getting pregnant, as early diagnosis can prevent major problems. Specific tests such as TSH, thyroid-stimulating hormone, free T3 and free T4, are essential to check that the thyroid is working properly. An altered TSH can indicate hypo or hyperthyroidism, conditions that impact fertility. In addition to these basic tests, in cases of suspected autoimmune thyroid diseases, such as Hashimoto's thyroiditis, additional tests for antithyroid antibodies, such as anti-DPO and antithyroglobulin, are recommended. These antibodies can attack the thyroid, impairing its function and affecting hormone production. Identifying these antibodies is particularly important, as they can compromise fertility even when T3 and T4 levels appear normal. Thyroid ultrasound can also be useful for assessing the presence of nodules or inflammation that can interfere with the gland's function and, by extension, reproductive health. These tests are therefore essential to understand whether a thyroid dysfunction is preventing pregnancy and guide the best treatment to balance hormone levels and improve the chances of conception. For women who want to get pregnant and face thyroid dysfunctions, the right treatment can be the key to balancing hormones and increasing the chances of conception. In cases of hypothyroidism, treatment usually includes hormone replacement with levothyroxine, a drug that replaces the T4 hormone that the thyroid is not producing enough of. This replacement adjusts hormone levels, helping to restore a regular menstrual cycle and promote ovulation. In the case of hyperthyroidism, treatment may involve antithyroid drugs to reduce the excessive production of hormones. In some cases, the doctor may recommend alternatives such as radioactive iodine or even surgery, depending on the severity of the condition and the patient's family planning. In addition to direct treatments, medical follow-up is essential to monitor TSH, T3, and T4 levels regularly, especially for women who are trying to conceive. Adjustments in dosage may be necessary over time, as hormonal needs can change. Finally, treatment must be personalized, taking into account the woman's general health and reproductive plans. This careful thyroid management is essential for a healthy pregnancy and for minimizing risks throughout the pregnancy. In addition, lifestyle plays a significant role in thyroid health and, consequently, fertility. Simple changes in routine can help improve hormonal balance and favor an environment more conducive to conception. Diet, for example, is one of the pillars of thyroid health. Nutrients such as iodine, selenium, zinc, and iron are essential for the production and regulation of thyroid hormones. Incorporating foods rich in these nutrients, such as fish, nuts, and green leafy vegetables, can support optimal thyroid function. In addition to diet, stress management is essential, as chronic stress can interfere with thyroid hormones and the reproductive hormonal axis, making conception difficult. Practices such as meditation, yoga, and light physical exercise help to reduce stress and promote better hormonal balance. Finally, quality sleep is also crucial for the thyroid, as sleep deprivation directly affects the endocrine system, including the production of thyroid hormones. Establishing a regular sleep routine and avoiding electronic stimuli before bed are simple but effective steps to preserve the health of the gland. Adopting these healthy habits contributes to thyroid stability and improves conditions for fertility, providing a more balanced body environment for pregnancy. As we have seen, thyroid health plays a crucial role in fertility and can be the deciding factor for those trying to conceive. Understanding the body's signals and seeking appropriate medical support can make all the difference. Remember, the thyroid is a small gland, but it has a huge impact on hormonal balance and the ability to generate new life. If you're struggling to conceive, consider investigating your thyroid function. Sometimes the path to realizing this dream can lie in adjusting small hormonal details. Keep following our channel for more tips and information on health and the thyroid, and take good care of your health every step of the way.